How much menstrual bleeding is too much? What causes it? What tests do you need? And is it dangerous? Welcome back to the FemHealth channel, a medical education channel by doctors for you. Heavy menstrual bleeding can make your period feel overwhelming. You might miss school or work, spend a lot of money on period products, or feel tired all the time. If your period is making life harder, it's important to know what is normal and when to ask for help. Heavy menstrual bleeding affects around 17% to 37% of women of reproductive age. Other studies, especially those focused on teenagers, show that about 34% to 37% of teenagers experience heavy menstrual bleeding, so this is about 1 in every 3 teenagers. Global research suggests that up to 1/3 of women will experience heavy bleeding at some point in their reproductive years. First, how is a normal period different from heavy bleeding? In a normal period, most people bleed for 4 to 5 days. The first day or two is usually the heaviest, and then the flow gets lighter. Doctors say a normal period lasts no more than 7 days. In adults, your period should come every 21 to 35 days. For teens, it's normal to have cycles that are a little longer, between 21 and 45 days. On average, people lose about 30 milliliters of blood during their period. Doctors look at symptoms and how much your period affects your life instead of exact numbers. So, what counts as heavy menstrual bleeding? Doctors call it heavy menstrual bleeding when your period lasts longer than 7 days, or if it makes you feel physically, emotionally, or socially unwell. It may also mean that you have to change your period products very often, or that you pass large blood clots. In a normal period, people use about 3 to 6 pads or tampons per day, and their period usually lasts up to 7 days, but not longer. This is considered normal. If you use more than 6 pads or tampons a day, or need to change them more often than every 1 to 2 hours, or if you get up at night to change your pad frequently, it might mean you have heavy menstrual bleeding and should talk to a doctor. Needing to wear both a pad and a tampon at the same time to avoid leaks is another clue. If you pass clots that are bigger than the size of a quarter, that's also a red flag. You may feel weak, tired, or short of breath during your period. These can be signs of anemia, which happens when your body doesn't have enough iron. If your period causes you to miss school, work, or fun activities, that's a problem worth talking to your doctor about. You can't collect and measure period blood easily, but you can estimate it by keeping track of how many period products you use. A regular tampon or pad holds about 5 milliliters of blood. A supersized tampon or pad can hold around 10 to 15 milliliters. A menstrual cup may hold between 30 to 60 milliliters, depending on the brand. If you're changing fully soaked products often, you might be losing more than 60 milliliters of blood per cycle. This could be a sign of heavy bleeding. But what causes it, and can heavy menstrual bleeding be a sign of something dangerous? Some causes are related to the structure of the uterus. These include polyps or small growths, adenomyosis, which is when the lining of the uterus grows into its muscle wall, fibroids, which are non-cancerous tumors, and even cancer of the uterus or cervix. Other causes are not related to the structure of the uterus. These include bleeding disorders like von Willebrand disease, hormone problems like thyroid disease or polycystic ovary syndrome, PCOS. Some immune system conditions like endometriosis or adenomyosis may lead to pain and heavy bleeding can be dangerous depending on the cause or if blood loss is significant. To understand what's causing your heavy periods, your doctor may order several tests. Before you see your doctor, it helps to track your periods. Write down how long they last, how heavy they are, and how many pads, tampons, or cups you use each day. Bring a list of all the medicines and supplements you take.